Cold and flu season here, but right now, hospitals across the country and here in Central Florida are dealing with the threat of a triple-demic as 3 respiratory illnesses are spreading at once.
So the possible convergence of the flu, COVID-19, and now a pediatric respiratory virus has doctors a bit worried in some cases. News 6's Carolina Cardona spoke to leaders at Advent Health about the cases they are seeing.
Well, our primary concern is with influenza. During a flu season, we'll see an increased rate of hospitalizations and complications.
Dr. Tim Hendricks of Advent Health Central Care says the influenza never left during the summer, and Central Florida is now starting to see a rise in cases.
60% increase just in the last week in the number of people testing positive for influenza.
As for COVID-19 cases,
we are seeing less COVID-19, but we are still having some positive patients come into CentraCare. This is the time of year when we start seeing an increase in respiratory illnesses.
The flu has obviously been the biggest one traditionally. Respiratory syncytial virus, or RSV, is one that hits pediatric population more than adults, and it comes around the same time.
The respiratory illness known as RSV has been surging around the country. According to the Department of Health, 36 states have reported RSV cases are rising as a trio of viruses, COVID, the flu, and RSV. More than 70% of pediatric beds are already occupied nationwide.
We are not one of those states. It's not here yet. It is in other places. We forget that. So the respiratory viruses spread easily when we're really close to each other, stuck indoors. We're not there yet.
Dr. Todd Husty, Seminole County's medical director, says that doesn't mean Florida is exempt. Those type of cases begin later in the year. So how is RSV different from the flu and COVID?
So a harsh cough at night or wheezing really sort of signifies that this is breathing tubes, which is probably RSV, not the flu and not COVID.
A virus that keeps kids and parents up at night due to that harsh coughing.
It's a pain, and it's difficult for the kid, and it's difficult for mom and dad, but it's not really horrible. RSV does get into the breathing tubes and does cause shortness of breath and some difficulty breathing. So more of those kids will be admitted, but it's very treatable.
In Orange County, Carolina Cardona, News 6.
For more on this year's flu season predictions and where to get the vaccine, just head to clickorlando.com/health.